I love all these guys I've taken care of. Everyone's got a story. You know, as a rule, they're perfect gentlemen, but they perform at a level that it's just like for a common man, it's unbelievable. They've been selected out of thousands and thousands of people who play baseball or play football, but these guys are at a totally different level. You know, the best way I can explain it to the layperson is there are people who can tell the difference between wine, right? A Merlot and a Pinot Noir. To me, it's red wine, right? Or cheese, so they've developed this high level of taste. Now you have a world-class athlete. They don't see the way we do. It's the same way I take care of a lot of artists, interior designers, musicians. You know, they're much more sensitive to their senses. They're trained to do that. They see things differently. They see more of what's there. They see color more intensely. One of my favorite patients was a guy named Chad Lewis, who was a tight end for the Eagles. Chad's this big guy, wonderful guy. And he was having a little blur, and I'm going like, you're fine. No, I gotta get LASIK. This is early on. So I did his LASIK, and after he'd had his LASIK done, they went on to get to the Pro Bowl. He caught a pass in the end zone that got them to the Pro Bowl. And Chad always said, well, before I had LASIK, I was wearing contacts. And so when I'd look to McNabb, who was this quarterback, I could see him, but sometimes it'd be slightly blurred. Well, these are guys who are performing at the edge of possibility, right? When he had LASIK, he said, I always could see perfectly. I could tell how he was putting his hand on the ball, where he was going to turn it. I could see things I'd never had seen before as well and consistently. So when he won that Hail Mary pass, I caught it, and we went to the Pro Bowl. One of my very good friends, John Bello, founded the company called Sobe, the drink that he sold to Pepsi for $300 million. John and I went to college together. And John built the NBA, the NFL, right, the football league, into the largest, really, marketing organization there was. He was an incredible marketeer, right? And people, like, they spend $300 or $400 to go see an Eagles game, right? I have a rule about athletics. Every minute, every dime is spent on me. Play golf, ride my bike, run, ski, whatever it is. I don't go and watch athletics. So I'm not the sort of guy who wants to be the team doctor, right? I don't want to be there on the bench watching these guys. So they find me because the trainers know. The trainers talk to other trainers, they've sent patients, and they select out, they know what these guys want. I remember when I did Matt Geiger, he was center for the 76ers, Larry Brown, right? Okay, you're operating on the center of the 76ers, right? And he said, well, I want to buy insurance. Supposing you screw up, doc, you know? So we called Lloyd's of London. They said, well, you know, he'll buy a policy, let's insure him for $5 million, you know, whatever. They wanted $30,000. And he said, well, okay, we'll do it anyway. And he had a small complication, a variance of normal. But I mean, got to think about it. You're operating on this guy, the $5 million guy, right? His future, think about the front page of the Inquirer. If you aren't calm, collected, and hadn't done this before, you could have a problem or create a problem. I always say incidents sort of adding up to accidents. In my life, issues are just, oh yeah, that I do this next, I do that next. So incidents don't add up to accidents for me. So these players find me through their trainers, word of mouth, because I don't want to be the 76ers doctor. I want to be here taking care of the average person who really appreciates what I do. That's just to give them confidence that they've selected a doctor who maybe has a few more skills. Because just, you know, what do they call the medical student who graduates last in his class? Doctor, right? And so how's the public going to decide who's really skilled or not? Well, it's very hard, really. And people with the biggest reputations sometimes are the worst surgeons. Surgeons with the best bedside manners sometimes are the worst surgeons. it's very difficult for the public to decide. We track our results. We really, I don't get invited to be a speaker because I'm a schmo, I know what I'm doing. Other surgeons watch me. They say, oh, I'd like to learn that. So it's a long life's course to get things right. And when you're under the laser, you want it right. And you want somebody who can do it right.